Bonjour, mes élèves. Hello, dear students. Dr. Dinka here with a lecture today on France's healthcare system. We're going to see how France funds its healthcare system, some of the main features of their system, and also why France is number one in healthcare in the world. OK? Bon, donc aujourd'hui, on va parler sur le système de santé en France. So today we'll talk about the health system in France. And what's very interesting is that their system is part of a broader social security system that includes la retraite, retirement, le chômage, some safety net for unemployment, and other benefits that French citizens have. So let's have a look, an in-depth look at the system. So the French healthcare system, it's a universal healthcare financed by government, national health insurance, and I'll talk about how it works in a little bit. Going back to 2000, when there was an assessment of the world health care systems, the World Health Organization found that France provided the best overall health care. So not just the best healthcare system, but the best overall health care. In about 2017, France spent about 11% of their GDP on healthcare, versus the US that spent about 17, so a lot more, and it's almost like a contradiction. How come France spends less and everybody's covered versus the US that spends more and not everybody's covered? So this has to do with history a little bit. We're talking about the government of Lionel Jospin that put in place universal healthcare coverage and extended the coverage to all those legally resident in France. Only about 3.7% of hospital treatment costs are reimbursed through private insurance. And there are also in France public hospitals, nonprofit, independent hospitals linked to the public system, as well as private for-profit hospitals. So the provision and management of the healthcare system is responsibility at the national level. That falls on the Ministry of Social Affairs, Health and Women's Rights, set the agenda. And however, the state has increasingly been involved in controlling the expenditure of the statutory health insurance, SHI. So the SHI covers the entire population, and according to the Commonwealth Fund, and we have an article from that for this week. Now the SHI is broken up into schemes or plan. Each of them do not compete with each other and cover a different portion of the population based on occupation. The SHI covers most costs of hospitals, physicians and long-term care, and prescription drugs as well. Patients are responsible for co-insurance, co-payments, and balance bills for physician charges that exceed covered fees. And according to the health systems in transition, the delivery of healthcare is mixed. That includes private fee for service or remuneration à l'acte of physicians, public hospitals, private and non-private hospitals, as well as private profit-making hospitals. So we have a mix. And in this article that we're reading for this week, you have the organization of the healthcare system, and you see all these different actors that have to, and organizations that have to come into place for this very complex system to happen. Okay. So as we mentioned, the provision of the healthcare is a national responsibility. The Ministry of Social Affairs, Health and Women's Rights, is responsible for defining the national health strategy, sets and implements government policy for public health, as well as the organization and financing of the healthcare system. Now, how does this universal healthcare coverage work? So was achieved over 7 decades by extending statutory health insurance to all employees in 1945 and retirees in 1945. So right after the Second World War, when France had the private insurance health system, the government realized that was not enough to rebuild the country that was left in ruins after the German invasion. So this is the reason one of the reasons they provided this statutory health insurance to everybody. Then in 1966, this was extended to the self-employed and the unemployed in 2000. In 2000, you also have La Couverture Maladie Universelle. This is the Universal Health Coverage or CMU that was created for residents not eligible for SHI. Although the program required yearly renewals and entitlement changes whenever a beneficiary's profession or family situation changed. After the implementation of CMU, fewer than 1% of residents were left without baseline coverage, and we can compare this to the United States. We actually have a video that talks about it. So the percentage of people in the US not covered is a lot higher than in France. In January 2016, the SHI eligibility was universally granted out of the Protection Universelle Maladie, or also Universal Health Protection Law. Now, you know, maladie means disease in French. So it's talking about protection, universal protection against disease, right? But the English translation is Universal Health Protection Law, or PUMA, to fill in the few remaining coverage gaps. Now, the law also replaced and simplified the existing system by providing systematic coverage to all French residents, and it merged coverage for persons previously covered by the universal healthcare coverage and immigrants covered by the state-sponsored health insurance. Okay. So how is this SHI financed? And it's very interesting because a lot of it's based upon payroll taxes that people pay. So that provides about 53% of funding. Now that's different than in the United States, because a lot of people, they pay for Medicare. So people working there paid for Medicare, which is a system that after people retire, but not for the actual healthcare system while they're employed, unless they're full-time and their company covers them. Part-time people are not covered by that, okay? So they have to find healthcare elsewhere. Now, in France, with employers paying about 80% of the tax and employees paying the rest, and contributions are calculated from the actual salaries kept in euros. You have about 3,311 euros per month, about $4,000. So national earmarked income tax contributes to about 34% of funding. And you also have, very interestingly, tax levied on tobacco and alcohol, because in their opinion, these are toxic substances that negatively affect the health. So if these industries make money from, in a way, getting people sick by the tobacco and alcohol, they should, some of the taxes when people buy those products should go to the health coverage. Also, the pharmaceutical industry and voluntary health insurance company provide about 12% of funding. The state subsidizes about 1% of funding. Now, coverage is mandatory and is provided to all residents by non-competitive statutory health insurance funds. Historically, there have been about 42 funds, and annual contributions are determined by the parliament. The SHI scheme in which workers enroll is based upon the type of employment, and unemployed persons are covered for 1 year after job termination by the SHI scheme of their employer and then by universal health coverage law. A citizen can opt out of the SHI only in rare cases, such as when they're employed by foreign companies. And you have here le bulletin du salaire, or a pay stub in typical pay stub in France. And you can see here this is le salaire brut. This is what people earn, and then you have all these deductions from their paycheck. Okay, so the first one is what? Santé. Okay, so this would be sécurité sociale malade, invalide, complementary incapacité. So all of this goes into, this is how much they pay from their paycheck, right? For their health insurance. Then they also have to pay for the retraite. We'll talk about la retraite in the system, the pension system, next week. And also le chômage, assurance du chômage. So this would be the unemployment. Okay, so you see that the first one, it's the health insurance that they have to pay for. Now let's talk about les hôpitaux. So we have l'hôpital, the hospitals. There are public institutions account for about 65% of hospital capacity and activity. That's a lot more in the EU than in the US, because we have also a lot more private hospitals in the US. Private for-profit facilities account for another 25%, and private nonprofit facilities make up the remainder. Now, all hospitals are reimbursed under the SHI via the diagnosis-related group system set by the Ministry of Social Affairs, Health, and Women's Rights, which applies to all inpatient and outpatient admissions and covers all medical services and physician salaries in public and not-for-profit hospitals. Neither bundle payment nor performance incentives exist. Now, hospitals are reimbursed for certain expensive and innovative drugs and devices in addition to this tariff, and a list of covered drugs and devices is updated every year by the Ministry of Social Affairs, Health, and Women's Rights based on semi-transparent criteria of innovativeness, price, and the share of the DRG population requiring the innovative drug or device. Now, public hospitals are funded mainly by the SHI, about 80%, with voluntary insurance and direct patient payments accounting for their remaining income. Public and private nonprofit hospitals also receive research and teaching grants and provisions for providing emergency services, organ harvesting, and organ transplantation. Now, some more statistics. Eurostat reports that only about 12.7% of French residents reported having unmet healthcare needs due to financial reasons as of 2019. That's a big percentage. And the figure is modest compared to over 25% residents in Portugal and Finland. You have the freedom in France to choose your doctor. It doesn't have to be the in-network doctor like they have in the States. So, for example, my doctor doesn't work with my current health insurance plan. My dentist, so it's very difficult because you have to pay out of pocket and it's a lot of money. Also, you don't need a referral for a specialist. So if you have, for example, some problems with the heart, or you can just go to a cardiologist without the primary care doctor referring you. Now, services covered. The cover benefits under the SHI are defined at the national level by the Ministry of Social Affairs, Health and Women's Rights, as we mentioned, and these are grouped under the National Union of Health Insurance Funds, an umbrella organization. So the SHI covers the following. So first of all, hospital care, very important. treatment in public or private rehabilitation or physiotherapy institutions. Also covers the outpatient care provided by general practitioners, specialists, dentists, physical therapists, and midwives. All maternity care services, newborn care and children preventative health care up to age 4, diagnostic services prescribed by doctors and carried out by laboratories and paramedical professionals, prescription drugs, medical appliances, including durable equipment such as wheelchair and prostheses, and they have been approved for reimbursement, and prescribed healthcare related transportation and home care. Now, for those people who travel, how do you register for French healthcare if you visit France? So if you lived in France for longer than 3 months, you can register for the French healthcare via the local CPM, Caisse Primaire d'Assurance Maladie office, and you can find it on a DMLE website. If you're employed, your employer will first register you with the French social security system. And if you are self-employed, you can see another website to get coverage. You may need to show certain documents, for example, your passport, valid ID, proof of French residence, proof of address, such as a recent utility bill, marriage or birth certificates, including family members, proof of income, like employment contract. You also need to choose a primary care doctor, submit a declaration to your insurance before accessing healthcare in France. And once you register, you should receive a carte vitale within a week. This is that carte vitale, and it's a green healthcare, health insurance card that has your photo and has a chip that contains a lot of information about you as a patient, medical history, also financial information related to you as a patient. And you'll need to take your carte vitale with you to all medical appointments in order to access free health care or claim a reimbursement. All right, so le fin, this is the end of today's lecture. Hope you find this useful. If you have any questions, any comments, please email me and let me know. I appreciate your participation in our online class, as always, and hope you have a good week. À la prochaine. Till next. Thank you. Merci beaucoup.